Can you see me, doctors?
Yes.
All right. Okay, so let's get started, Dr. Yuka. You will have what? You will have 1.5 minutes to read your question, okay? And then we can start. Let me share the screen first.
Begin.
Start.
Yuka Urma GMC number is 12345. Hello,
Hello.
I'm Dr. Yuka Urma, one of doctors in rheumatology. Can I confirm your full name and age, please?
Yes, I'm Molly Forge, doctor, and I'm 45 years old.
Okay. Hello, is it okay to call you Molly?
Yeah, it's fine, doctor.
Okay. I can see from my notes that you came here because of headache. Am I right?
Yes, doctor. I've been referred by the GP. Yes, my headache. Yes, doctor.
Okay. Could you tell me more about it?
It started 3 weeks ago, doctor. Here
3
in
weeks
the
ago.
left, in the left part of my head, and it's getting worse. Yeah.
I'm really, really sorry to hear that. It's been a long time for you. So, what about the other side, the right side?
The right side is fine.
Okay, good. And then, did it happen suddenly or gradually?
It started gradually.
Gradually, okay. And what type of pain is it?
I feel pain here, okay, and tenderness as well in this part in my head.
Okay, all right. And then, did the pain move to anywhere else?
No.
Okay, all right. And then is there anything that makes your pain better?
Better? No.
Did you try any medication for it?
Paracetamol, but it doesn't help at all.
Okay. And then anything that makes your pain worse?
When I'm chewing.
Oh, chewing. Okay. All right. And then on a scale of 1 to 10, with 1 being the no pain and 10 being the worst pain in your life, which number is your pain now?
7.
Okay. It's pretty hard
Yeah.
pain for you. Okay. Do you have any other anything else apart from headache?
Yes, I do have some pains and aches in my shoulders and thighs as well.
Oh, shoulders and thighs. Okay. Any fever?
No fever.
Okay. Did you have any injury or trauma?
No.
Okay. And then, okay. Right. Yeah. And any nausea, vomiting?
No at all.
Any rash?
No.
Okay. Good. Any neck stiffness?
No.
No. Okay. All right. So I'd like to ask some questions about your past medical history. Is it the first time you have this headache?
Yes, doctor.
Okay. And then do you have any medical conditions like high blood pressure?
No.
No. Okay. All right. And then are you on any medication now?
No.
No. Okay. Any allergy?
No.
Does anyone in your family have same kind of headache?
Not that I'm aware of.
Okay. All right. And then let me ask some questions about your lifestyle. Do you drink alcohol?
No.
Do you smoke?
No, doctor.
Do you do exercise regularly?
I'm walking every day, 30 minutes.
Good. And then how does this headache affecting your life?
It's been there for 3 weeks now. So,
Yeah.
sometimes I just lie on the couch with this headache. I just need something to help me in that. Yeah.
Okay. Okay. I'm here to help you. All right. Do you have any ideas what's causing this headache?
Yeah.
And what do you expect for this visit?
Anything to ease this pain and to know what do I have exactly.
Okay, I'll try to address your concern. Okay, and then do you have any problem with your vision?
Yeah, I do have blurry vision as well.
Blurred vision. Okay. Any pain in your eye?
No.
Okay. Good, good. So I'd like to move on to physical exam. I'd like to check your observation, and I'd like to examine your head, neck, and vision as well. Is that okay?
Yes.
And then I'd like to do some blood tests as well. Okay. Okay, so Molly, from the chat we had and from the examination,
Yes.
you're having this headache for the past 3 weeks, and you have vision problem as well. And I suspect that your condition is called giant cell arthritis. Yeah, have you ever heard of it?
No, doctor, what is that?
So this condition is the inflammation of your artery on the
Minutes
side of
remain.
your head. In your case, right sides. Are you following me?
Yes, doctor.
So we'd like to do further investigations. For example, to take some samples from your right side artery on your head to make an exact diagnosis.
But
Is
the
that
problem
okay?
is in my left side, doctor.
So on your on your left side. So I think there's an inflammation in the artery of your head.
Yeah.
So we're gonna take some small sample from your artery and send it to the lab and see that and give you the exact diagnosis for you. Is that okay?
Yes, doctor. So is it serious problem, doctor?
Oh, I'm afraid that this condition is affecting your vision, and that is that might be the serious problem. I'm worried. So we need to refer you to an eye specialist as well to assess your vision. Is that
Yeah.
okay?
Yes, yes, doctor.
Okay. So then for the treatment, we need to start the steroids as soon as possible. And yeah, is that okay too?
Yes, yes, doctor, of course. Yeah.
Okay, for your safety, if you feel vision is getting lower or if you have getting a headache in more severe, please let us know anytime, and I'll give you the leaflets about the giant cell arthritis.
All right, doctor. So when I'm going to be seen by the eye specialist?
So we're gonna refer you to the eye specialist immediately
Move on
because
to the next station.
Okay, time's up. All right. Okay, thank you, Dr. Yuka. So how do you feel?
yeah, during the taking history, I forgot to ask about the vision. So yeah, I asked the vision problem in the late of the consultation, and yeah, management. I should have said more for management. So
Yeah.
I forgot some, I think.
Okay. So in terms of the data gathering or the history taking, I do agree with you. You've missed the vision and also neurological symptoms.
Yeah.
Yeah. So but you've asked about the vision lately, okay? And this is a good thing that you didn't miss it. All right. In the management,
Begin.
what is the management of giant cell arthritis?
So I need to give some painkillers for the
Okay.
pain.
What
And
kind of painkiller in this particular case?
we need to start NSAIDs, ibuprofen or something because paracetamol didn't work. And
Okay.
yes. and steroids is necessary.
Okay, what else?
And the patient has the left shoulder pain as well, so we can refer the patient to the physiotherapist.
Painkillers, high dose corticosteroids, aspirin, and you can add PPI. Okay, what is PPI? Is the stomach protection medications for avoiding ulcers in the stomach because of the steroids and aspirin as well. Okay. All right, what is the next step in the management? So the patient is now with you in the rheumatology, right? Referring the patient to the eye specialist because of the vision problem. Immediate referral to the eye specialist. If there is no eye affection, you don't need to refer the patient to the eye specialist. And ultrasound, okay? Ultrasound first. And you can do CT scan if you want before doing the biopsy, but ultrasound and biopsy, okay? Rheumatologist can do the biopsy, okay? It's based on the hospitals and, you know, the facilities in each department, but rheumatology can take the biopsy. Eye specialists can do the biopsy as well. So it's based on the facilities. Any one of them can do the biopsy and the ultrasound. Okay. So this is in terms of the management part. Do you think that giving leaflets in this case is appropriate? The patient has blurry vision, okay? So
Yeah.
no need for leaflets, okay? And also the patient might stay in the hospital if they want to keep her to do these these investigations, and also for the eye affection, okay? So no need for the leaflets in this case. All right. Okay, so let me give you the marks. In data gathering, in the present history, missed vision and facial weakness, neurological symptoms, 1 mark to be deducted for the neurological symptoms. You told me about the bloods, but after I gave you the bloods, okay, don't miss taking the bloods from the patient. Okay, 3. In the management skills, 2 to be honest. Okay, 2.
2 minutes remaining.
2 in the interpersonal skills. 5, 6, 8, 7. Okay, taking the management. Taking listening, because you told me that the pain, or we are going to take the biopsy from the right side and it's in the left side. Yeah. What else? Nothing else. Okay. All right. All right, Dr. Yuka, thank you for your participation. Do you have any question?
Yes, so for the safety netting, what can I explain about the safety netting? Is it okay to say just if the symptoms getting worse, please come back, or should I say about the side of steroid or something?
Yeah, it's fine. A good question. All right. This patient, do you think that this patient is going home today?
No. We need to keep in the hospital.
He might be admitted in the hospital, okay?
Yeah.
By the eye specialist, all right? Or maybe you are going to admit the patient to do the investigations, all right? So do you think that safety netting in this particular case will be proper or appropriate?
We can monitor the patient, so it's not necessary.
Yeah, not necessary, okay? You just tell him, all right, you might be with us in the hospital, okay, to do these bloods and also to be seen by the specialist, the eye specialist. So if you have any concern, if you have any question, please ring the bell. Okay. This is the thing in this particular case. But if the patient is going home and he will be seen by the rheumatologist within 2 days or 3 days, because the referral, let's say that the patient is in the GP now, okay? If the patient is in the GP, all right, you will need to refer the patient a kind of urgent referral, but the patient should be seen within 3 days, okay, in GCA. So in this time or in this particular situation, you can safety net the patient. You can tell him, all right, if the symptoms are getting worse, if you develop any vision problem, if you develop any kind of severe headache, please seek urgent medical advice. Okay?
Yeah.
Got it? So it's based on
Yeah.
the situation and the context. Here, in the case that we have done, no need for safety netting, okay? But if the patient is going home, then you can safety net him about worsening of symptoms, vision affection if he doesn't have any vision affection, neurological symptoms, okay? So these are the things that you can safety net the patient about.
Okay.
All
Thank
right.
you.
Thank you. Any other question?
No, thank you so
Okay.
much.
Okay, thank you, Dr. Yuka. Let's see the questions of the doctors about the case. Then we can take the other case. If in the hospital an eye affection, do we admit the yes? What painkiller given, please? All right. In this case, you can step up by giving non-steroidal anti-inflammatory medications, and you can add codeine, okay? And also, or you can consider morphine or a morph. You can consider that. The pain is severe, it's 7, okay? So you can give non-steroidal and codeine, and if it's not helping, so you can step up. In this case, do we need to do a CT head in this case? Yes, you can. You can. The investigations in GCA are ultrasound, CT, and biopsy. The safety netting, we have talked about them. According to, we don't give aspirin anymore for GCA. So is it appropriate to give in the case? According to NICE guidelines, you will give aspirin. Okay. No aspirin. Let's see it together, doctors. Let's see it together on the internet, on the website. Okay, let's see it together. We are going to get into the NICE guidelines and see it together. All right. Maybe there's another change recently. What painkiller, doctor? We have talked about the painkiller, and in the ACR diagnostics criteria, the age of GCA diagnosis at least of 50 years age. Yes, doctor. Okay, but there are some differences or some exceptions. Okay, there are some exceptions for any rule. All right, the patient has tenderness in the left side of the head. She has also headache and thigh and shoulder pains. All of these are suggestive of GCA. Okay, you didn't say to the patient, sorry, doctors. You didn't mention to the patient that you have giant cell arthritis. You will say to the patient, you might have. And for this, we are going to do these investigations. Okay, she had pain in her shoulders and hips. Should we assume that she is already diagnosed with polymyalgia rheumatica? You can ask the patient. Do we ask about smoking or diet? If you are a fast speaker, you can ask these questions in this case. But if you don't ask them, it will not harm you at all. All right? Checked it. We are going to check them, doctors. We are going to check them. GCA, CKS. Yeah. Let's read it together. If no aspirin, so there is a change in the guidelines. Giant cell arteritis is a medical emergency. Early treatment with effective doses of corticosteroids may prevent serious complications such as vision loss. If there is a new visual loss, you are going to arrange an urgent appointment. And depending on the clinical situation, you can give 1 dose of corticosteroids. The dose of corticosteroids is here for all other people with suspected GCA. Urgent discuss with a specialist and refer using a fast track local GCA pathway. So the specialist assessment will be the rheumatologist. The patient should be seen within 3 working days. GCA should be immediately treated with glucocorticoids, okay, and the dose is 40 to 60 oral prednisolone per day. Consider arranging the following blood tests, okay. Will be confirmed in secondary care with investigations such as ultrasound and biopsy. Response, if no response, all right. Ensure person understand that the importance of attending the regular follow-up. Okay. If giant cell arteritis is suspected, don't delay referral. The following test may be, depending on the clinical situation, these are corticosteroids. Okay, no aspirin here. All right, so there is a change in the guidelines. No aspirin anymore in the guidelines. All right, thank you, doctors. Thank you for sharing the information with us today. The NHS will, yes, so there is, okay, doctors. There is no hard rule. There is no hard rule for all of the cases, okay? The guidelines are there to guide you. The guidelines are there to guide you, all right? But it is not mandatory. So it's based on the, the local arrangements and the local guidelines for each specific place, all right? If you give aspirin, it's not a harm. If you give aspirin, it's not a harm because GCA is associated with high clotting formation. Again, the NICE guidelines are guidelines to follow. You can do all of them. You can do some of them. You can do just half of them. It's based on the local arrangements for each hospital and for each GP. Got it, doctors? Got it? Any more questions? So the conclusion is, if you give aspirin in this case, this will not be a harm. All right? Don't just spend too much time in arguments that will not help in understanding the issue of the case. Okay? The treatment, the guidelines are giving painkillers, high-dose corticosteroids, stomach protection in NICE guidelines, and in the NHS it says give aspirin, so combine all of them and give it to the patient. It is safe. Why it is not safe, doctor? It's safe to give, okay? Yeah, right? Don't spend too much time in something which is not the issue of the case. And this is something that you will find between the practice groups, okay? You spend too much time in arguments Don't argue. Just find the issue of the case and move on. What are the issues in this case? The issues are in the history taking. You have to explore the pain very well, right? You have to find out if is there a specific thing happened before these 3 weeks or not. You have to find out, did the rheumatology tell the patient anything about her condition or not? You have to exclude vision problem. You have to exclude neurological symptoms, all right? You have to order the relevant basic investigations, all right? What are the relevant investigations here in GCA? Full blood count, ESR, CRP, inflammatory markers, all of the inflammatory markers, all right? You have to examine the patient very well, check the observations, examine the neurological examination, vision, fundoscopy, and in this particular case, you have to examine the joints. These are the issues in the data gathering. In the management, you have to explain the diagnosis very, very well. You tell the patient, you might have this, you might have this, and this is a kind of inflammation in the big vessels in the head. It is associated with high clotting formation, and it could be serious. That's why we need to take an urgent action. Don't scare the patient, okay, but show the urgency. Tell the patient the good thing that you came in today, the good thing that we are going to take the steps early to treat you, and don't worry, you are in safe hands. We are going to do our best to help you, all right? But you have to show the urgency. This is one of the main issues in this case. Then you have to find out, where is the patient exactly? Where are you exactly? What is the next step? Are you going to give medications to the patient now? Or you are going to refer the patient right away to another department, or you are going to do investigations before, all right? So these are the main issues, and you have to consider that in your practicing. Think about the issues instead of just thinking about few arguments that will not help you at all in your studying, all right? Okay. In the management, you will tell the patient, all right, for this, we are going to start you on appropriate painkiller, as the paracetamol is not helping. So we are going to step up. We can give you non-steroidal anti-inflammatory, which is ibuprofen and codeine as well. If it doesn't help, or if they don't help, we can step up. We can consider morphine in your case, okay? So we also need to start you on high-dose corticosteroids and aspirin to prevent clotting formation. And then you will be referred to the eye specialist right away to be seen there. Okay? We are going to do some investigations in the form of what? Ultrasound. We might need to do take a sample from the vessel in your temple to reach the definitive diagnosis for giant cell arthritis. Do you have any problem in this? Okay, this is in this particular case, the patient in rheumatology. The patient in rheumatology. What if the patient is in the GP without vision affection? In the GP without vision affection. Can you tell me, doctors?
We'd also give the corticosteroids, painkiller, and stomach protection, and then refer in 2 weeks.
Refer in 2 weeks, and the patient should be seen within 3 days. Okay? All right? Yeah. Okay. And what if the patient is in the GP with vision affection?
To be referred immediately.
To the eye specialist.
Yes.
The patient will take prednisolone, corticosteroids, and painkillers, can add aspirin, and then you tell him about what is the next step, or what are they going to do in the hospital or in the clinic. Then you safety net the patient. Any more question about this case?
Yes, doctor. If the patient he is diagnosed with PMR and he has got GSA, so he's already on a steroid. So how would you treat that? So what we have to do because he's already on steroids.
Give the high dose corticosteroids and then refer the patient immediately to the rheumatologist.
Okay, thank you.
Okay, without any, if it's without any vision affection. Yeah. All right. I'm happy with these discussions, doctors, because it gives you a better idea about how to deal with each case. Okay, but from the exam point of view, usually they are going to give you a kind of simple case. They are not going to trick you. All right. They will give a case which is not on any corticosteroids. So what are you going to do to the patient? Okay, but all right. So let's do the next case.
Begin.
Start.
Hello,
Hello.
I'm calling for Max Forge.
Yes, doctor.
Well, hello, I'm Dr. Shahab. I'm one of the doctors from the GP practice. I'm calling you regarding you had requested a phone appointment. Is that right?
Yeah. Yes, doctor.
Well, thank you. What may I call you, please?
Max.
All right, Max. Before we get started, I'd just like to make sure I'm talking to the right person. So, can you confirm your age for me?
It's 21, doctor.
Thank you. And would you confirm your first line of address, please?
It's blah 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 blah.
All right. Thank you so much. So I understand from my notes that you have been having a headache. Is that right?
Yes, doctor. I do have headache. Yes.
All right. Well, I'll do my best to help you with that. So can you tell me about it, please?
It started when I woke up, and I do have this headache now for 3 hours, and I don't know what's that. What's that headache, doctor?
Got it. Okay. Is this the first time you got this headache?
Yes.
All right. And you mentioned it just started this morning, 3 hours ago. So did it come on suddenly?
I woke up with it, doctor.
Got it. Okay. And where exactly is the pain in your head?
All over my head.
Okay. Does the pain go anywhere else?
No.
All right. And have you noticed anything that makes this pain better?
Nothing.
All right. Anything making it worse?
Nothing as well.
All right. So, other than this headache, is there anything else you noticed that's bothering you?
The light is bothering me a bit.
Can you tell me a bit about that, please?
What do you want to know, doctor?
Well, do you find that the lights are too bright?
Yeah, it's bothering me. Yeah, I want to be in a dim room. Yeah.
Okay, I understand. All right. So, can you please tell me, Max, have you noticed any rash on your body?
No.
Okay. Have you been having a fever by any chance?
No.
Okay. Any chest pain?
No.
Have you vomited or felt sick?
No.
All right. So, can you tell me, Max, have you noticed any difficulty moving a part of your body?
No, doctor.
Is there any pain in your neck?
No.
All right. So, Max, can you tell me, please, about your general health? So, do you have a diagnosed medical problem?
No.
All right. And are you currently taking any medications?
No,
Do you have any allergies?
no.
All right. And a bit about your general life, Max. So can you tell me, do you drink alcohol?
Actually, I'm not drinking, but yesterday I was in a party
Mm-hmm.
and we won a football match,
All
and
right.
yeah, I drank alcohol with vodka and wine. Yeah,
All right. All right. Got it. So is this your first time drinking?
yes.
Okay. Okay. May I ask how much did you drink yesterday?
Um, maybe 3 or 4 cups of wine with vodka.
Mm-hmm.
Yeah.
I got it. Got it. Got it. Okay. Do you smoke, Max?
I don't smoke now.
All right. And you mentioned to me that you had a football match. Is that the sport you play?
Yes,
Okay. Do you practice the sport regularly?
yes.
All right. Okay. Um, so Max, do you have any idea what might be causing this headache you're experiencing?
No,
Okay. And well, I know about the headache, but I want to know about you. So what is the number one thing that's concerning you?
I just need anything to ease this headache. It's horrible.
All right, I understand. I'm really sorry to hear that. We should be able to help you with this. Okay. And is there, other than that, is there anything specific you're expecting from your appointment today?
Nothing specific.
Mm-hmm. Okay. All right. Well, um, thank you for answering my questions and bearing with me, Max, so far. Um, from what you've told me, it does seem that what you're experiencing is something called a hangover headache. Have you ever heard about it before?
No.
All right, I'll explain it to you.
2 minutes
This
remaining.
headache is related to alcohol consumption. And you mentioned to me you had this party yesterday and you had a lot of alcohol and it was your first time. So it is likely that what you're experiencing is the effect of the alcohol causing you this headache.
Okay.
Okay?
Yeah.
So, uh, you mentioned you wanted something for the pain. We should be able to help you with that. But in
Mhm.
your case, painkillers are not the most helpful thing. In fact, the most helpful thing would be to make sure that you drink a lot of water, make
Mm-hmm.
sure that you drink a lot of juices, and keep yourself well hydrated. Are you following me?
Yes, doctor.
All right. Another good idea would be to eat small, frequent meals to keep yourself well nourished, and this headache should go away on its own after some time. Are you following me?
Yes, doctor.
All right. I'd like to advise you about something as well, Max. Uh, it's not advisable that you drink in large amounts suddenly because it can cause you to vomit, it can cause you to lose your balance and get hurt, and it
Mhm.
has a damaging effect on your body systems as well. So I would like to advise you that to drink in moderation within the recommended limit whenever you are drinking alcohol. Does that make sense to you?
Yeah, it makes sense, doctor. So, could
Um,
it be alcohol poisoning, doctor?
well, it is unlikely to be alcohol poisoning because alcohol poisoning would maybe cause you loss of consciousness as well as other symptoms.
Mm-hmm. Okay.
And okay,
Move on to the next station.
Time's up. All right. Well done, Dr. Dr. Tahir or Dr. Who?
no, Shihab, doctor.
Dr. Shihab. Yeah, well done.
Thank
Well
you.
done. Okay. How do you feel?
Um, I feel like I could have done some safety netting. Unfortunately, didn't have time for it. I wanted to do some examinations, but it's not important to invite him to come over the phone. And I'm not sure how to handle investigations in a case like this, doctor, because it's
Okay.
over the phone. If it's something serious, obviously you'd have to invite them to come in. But in his case, I'm not sure if
Mhm.
I have to tell him to come in because the investigations are not that significant.
Yeah. No. Do you think that you need to do any investigations for this patient?
I'm not certain.
Yeah, from your opinion as a doctor, do you think that this case needs any investigation?
No.
No. So no need to ask the patient to come. Yeah.
Yeah. Okay.
Okay. Okay. So what is your opinion about your data gathering?
Begin.
Well, I feel I should have asked a few more differentials. I didn't have them ready in my head, unfortunately. I think I should have excluded a couple of very important ones are the trauma and any possibility of a hemorrhage, which I did not ask the questions for.
Okay. What did you ask about chest pain?
I'm not sure. I'm just doing a quick systems check.
All right. Do you think it's relevant or
Not exactly, but if it's nothing serious, I tend to find myself stuck without anything to do. So I just like to check anything in the chest, anything in the abdomen, just move on. Just just a wellness check.
Okay. But take care because sometimes the irrelevant questions can affect your marks badly or negatively instead of
Okay.
affecting them positively. All right.
All right, got it.
Hey, do you think that if you can give him an advice about driving would be okay?
I mean, yes, he is 21. He should be able
Yeah,
to drive.
you can include that in the management. You can tell him
Mhm.
as a safety netting, don't drive until you feel better, and try to calm or try to rest at home. And if he is asking you, can I go to my job? What is your answer in this case?
My answer is that you can take a day off from your annual leave, maybe
Yeah,
consider.
yeah,
And because we can't give him a sick note for this, he has to take a
yeah,
day from his annual leave. He can stay
yes.
home, he can rest a bit until he feels better and he feels competent to do his job, and definitely don't drive.
Okay. But just a correction, he can take a sick leave.
He
Okay?
can?
He can take a sick leave. All right? A sick leave, not annual, take a day from his annual leave. He can take a sick leave. The sick leave is a kind of once if you are feeling unwell in the morning of one of the days, then you can call your work and tell them that I'm not feeling well, so can I take sick leave? Okay, and the sick leave you can take it for maybe 1 or 2 months. If you take one day only as a sick leave, it's okay. You don't need to give any paperwork. If it's more than 1 week, you will have to contact your GP and take a sickness note and provide your work with it. Okay. So anyone can take sick leave for a period of time, but if it's more than 1 week, he should be able to provide a kind of sick note or a confirmation that he was sick.
Okay, so if as long as it's less than a week, he does not need a sick note.
Yes.
Okay, yeah, in this case, yeah, he can take maybe a
Yeah,
couple of
sick
days.
leave. Yeah, sick leave.
Got it.
All
Thank you so much.
right. Thank you, Dr. Shihab. All right, so let's talk about your marks first, and then we can see the questions, or we can see the questions at the end of this the session to avoid wasting of the time. Okay, data gathering. In data gathering, to be honest, you've done almost all of the important points. You explored the headache. Maybe you can ask me, is there any specific thing happened yesterday, just to have a clue? But you asked me about the alcohol. What else? You can ask me about the alcohol poisoning symptoms: vomiting, shortness of breath, loss of consciousness, and confusion. These are the symptoms of alcohol poisoning: vomiting, chest tightness or chest, shortness of breath, loss of consciousness, and confusion. You asked me about vomiting, and then you included loss of consciousness at the end when I asked you, is it alcohol poisoning or not? Well done. You can include the driving if you would like, either in the history taking or in the management. In terms of the examination, you can offer the patient
2 minutes remaining.
but in this particular case, it's not necessary to bring the patient to the GP. There is nothing alarming. Okay? So you handled it properly. Okay? In terms of your, so in data gathering, I think you are 3 in the data gathering. In the management skills, you explained the diagnosis very, very well. In the management, you told me about the advice, giving the advice to the patient in terms of taking painkillers, drinking and eating well. Small frequent meals. You can ask him to sleep very well. No alcohol in the next 48 hours. And you can safety net me about vomiting, shortness of breath, or feeling drowsy. Okay, so in the management, I think 3 as well. Interpersonal skills. I'm happy with your interpersonal skills, to be honest. You're calm, you're relaxed, you're asking smart questions. You asked me about the concern in a very good manner. And you explained everything in a perfect way, to be honest. So I could give you 4. Well done, Dr. Shihab.
Thank you so much, Doctor.
Keep it up, keep it up. Yeah. Okay. Nothing in the skills area, to be honest.
Move on to the next station.
Nothing in the skills area. Okay.
That's great to hear. Thank you so much, Doctor.
Thanks a lot. So for you doctors, I just need to share with you the picture that we have. The picture of the headache. Can you see this?
Yes.
Okay. It's a kind of reminder for you. Any acute headache, the differentials are trauma. You can ask about trauma, any specific thing happened like trauma. You can ask the patient in this particular case that we have done with Dr. Shihab, did you have any trauma to your head yesterday? Okay, then meningitis, you have any fever, any neck stiffness, any rash, then subarachnoid hemorrhage. You can ask about meningeal irritation. You've asked about them when you asked about or excluded meningitis. Then you ask about the neurological symptoms: facial weakness, arm weakness. All right, then vision problem, please. Vision affection, pain in the eye. Vision affection, pain in the eye. These are the most important differentials that you have to include in any acute headache. You can add some more if you have time, but these are the things that you can't miss. Okay? Trauma, meningitis, subarachnoid hemorrhage, vision affection, and pain in the eye. All right? If you suspect alcohol hangover, please ask about vomiting, chest tightness, and loss of consciousness. to exclude alcohol poisoning. All right? Hopefully it is clear. The questions, what about investigations and examination over the phone? We have talked about this. Give ibuprofen. Yes, you can give ibuprofen. Avoid paracetamol. Can we ask about recreational drugs? Yes, you can ask. Casual leave, sick leave. If he is a student, you just ask him to have a rest. What are the red flags in hangover headaches? We have talked about them. Thanks. I think we need to do safety netting around these symptoms. Yes. All right. Please make sure that you do understand the difference between alcoholism and binge drinking. Okay? In this case, it is binge drinking. The patient doesn't drink alcohol usually. He had alcohol just once yesterday. It's a binge drinking. So in this case, you just advise him about avoiding binge drinking. But if he has a history of drinking alcohol, then you can tell him it's highly advisable to cut down alcohol to the safe limit for every week. Do you know the safe limit for each week? Then if you have time, you can tell him. All right, but please don't mix up the alcoholism or chronic alcoholism with binge drinking. All right. Okay, let's do the next one.
Begin.
Start.
Hello. Hello.
Hi.
Hi. Hello. My name is Dr. Munir. I'm one of the doctor working in the GP surgery. May I know your name, please?
Yes, I'm Michael Armstrong, doctor.
What do you want me to call you, Michael Armstrong?
Michael. Michael is okay.
Okay, Michael, could you confirm me your age, please?
It's 45, doctor.
Thank you for confirming. Michael, could you please tell me what brings you in today to the surgery?
Yeah, I have headache, doctor. I have headache.
Oh, I'm so sorry to hear that. Michael, since how long you have this headache? Could you please tell me more about it?
4 days ago.
Okay. And this headache, did it start suddenly or was it gradual?
Just I found that I'm having headache and it's getting worse.
Okay. Could you tell me exactly where the headache is, like with the pointing with your finger? Is it like at the front, back?
Yeah, in the front of my head and my cheeks as well.
Okay. Is it going anywhere else? I mean, it's radiating to any other part of the body? I mean,
No.
like no. And how do you score the headache? Like if 1 being the 0 and 10 being the highest, what is the score of this headache?
5.
Okay. Is there anything which happened like since last 4 days and that triggered this headache?
I don't know if it's related or not, but before 4 days I had some runny nose and fever and cough.
Okay, I'm so sorry to hear. So, Michael, did you take any medication for it to relieve that?
Paracetamol.
Paracetamol. Did it help you?
Yeah, sometimes it helps.
Okay, so Michael, is there the headache? It's also going under your eyes. I mean, like, is there just to the face somewhere?
On my cheeks.
It's on your cheeks as well. All right. So, Michael, do you feel any pain, any temperature, like a fever?
I was having fever before 4 days, but
Did you? Okay. Did you check what was the fever? I mean, or it's just like you felt feverish?
yeah, I felt hot. Yeah.
Oh, okay. I'm so sorry to hear that. We will be helping you very soon after just all the examination. And by any chance, do you feel any like vomiting, any shortness of breath?
No.
Any slurring of the speech, any numbness, any part of the body,
No,
any dizzy spells?
no,
Okay. Did you have anything like that happen before, Michael?
no, doctor.
Mm-hmm. Right. Do you have any post-medical condition, for example, like diabetes, high blood pressure, or any other condition associated with it?
No,
Are you on any medication?
no,
Okay. Do you have any family history of any diabetes, high blood pressure?
no.
Okay. Okay, Michael, do you have any allergies?
Allergies? No, doctor, I don't have any allergies.
Okay. Right. So coming back to the pain, is there any discharge coming out from your nose?
Yes.
Is it like quite a lot, or is it just I
Yeah,
mean,
it's a lot and it's greenish in color.
oh, I'm so sorry to hear that. And this has been happening since you started this headache, right?
Yes.
Okay. All right. So coming back to your personal history, by any chance, do you smoke or you drink alcohol?
No.
All right. Okay. And Michael, what type of job do you do?
What can you tell me again, please?
What type of job do you do?
Yeah, I'm a teacher.
Okay. So is it affecting your job? I mean, is you won't be
Yeah,
able.
yeah,
Mhm.
I'm in a sick leave for 4 days now, doctor.
Oh, I'm so sorry. And
Yeah.
Michael, just one last question. When you bend your head forward, does the pain increases or does it? I mean, how does that work? I mean,
Yeah, increases.
okay. And do you have an idea what you are going through, Michael?
No, doctor.
Okay, I would be able to explain you everything. So first, I would like to do some observation, your blood pressure, your weight, and your temperature. I'll check the temperature.
Mhm.
And so, yeah, what's the temperature?
Temperature is normal.
Okay, thank you. And we'll check few more things. I'll check the back of your neck, a few nerve examination, and your vision, a few fundoscopy, and your ears as well. And also, I'll check your throat.
2
I
minutes remaining.
Thank you, Michael, for letting me examine. And I can, after examination, I have come to the conclusion and that the data gathering, I have come to conclusion that you are having a condition called sinusitis. Have you ever heard about that?
No, doctor, what is that?
It's like a condition in which that the sinuses are a part of the skull, in which that these are pockets, the empty pockets, when somebody has got some allergies, or it is the allergies to different types of things like bats or any other things, allergies, they get inflamed. And with the inflammation, what happened is that there is pus start developing in it, and then the pus start coming into the throat as well and to the nose as well. Am I making it clear? Is that any good? Is there any? If there anything that is not clear, then you can ask me the question.
Okay, you mean I have an infection in these sinuses?
Yes, Michael. So we are here to treat that. So the most important thing is, as like you mentioned that your discharge is coming as greenish, which means that now they are infected. So initially, we would advise you to start doing some
Move
sinus
on to the
rinse
next station.
or
Time is up.
and antibiotics.
All right.
Okay,
Okay. Thank you, Dr. Mosarat.
thank
So,
you.
how do you feel?
Well, I felt like I was a bit shaky, and in data gathering, I just took some time to find out the diagnosis.
Mm-hmm.
and that wasted the time, and I couldn't find the investigation. So
All right. Why do you need to investigate?
I mean, like we do a few investigations for the CRP and the inflammatory markers and full blood count in case if there is a specific infection we need to find out.
All right.
Mm-hmm.
Okay. Let's take it step by step. All right.
Right. Mm-hmm.
From the history taking.
Mm-hmm.
Okay. Why did you think, or why did you feel that it was difficult to reach the diagnosis?
Because I started with headache, and then when I asked something specific
Begin.
uh, thing that like for regarding the nose discharge, and I just realized later on that I should have mentioned about the pain near the cheeks just to confirm the sinusitis, and I was trying to find out could be the headache could be related to something else, because I was pushing myself more towards the tension headache, but suddenly then I realized that no, it's not that. So
But I told you from the start, it's in front of my head and in my cheeks as well.
no, initially you mentioned that it's just the headache is in front of the head, but
And
then
my
when I
cheeks.
asked
And my
yeah, the cheeks you mentioned later on when I explored that the headache, is it anywhere else on the face as well, and then you mentioned that it is on the cheeks as well, so then I realized that yeah, could be sinusitis.
I mean, Dr. Mosarat, no, darling, I told you from the
Okay.
start. I
Okay.
have, when you told me,
Yeah.
can you point for the
Uh-huh.
pain? I told you,
Yeah. Yeah.
um,
Yeah.
in the front of my head and in my cheeks as well.
Yeah. 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 Maybe I missed it. Yeah. Because
Yeah.
I myself
Okay.
have got sinusitis.
No worries. So this is the first thing. Okay.
Yeah.
The second thing, if
Mhm.
you just included in your exploration
Right.
anything that makes it worse, anything that makes it better,
Uh-huh.
this will
Oh,
help you.
oh yeah. Just moving the head forward, it makes it worse. Yeah. Yeah. Yeah.
Yeah.
Yeah. Yeah. Yeah.
So the exploration, or very well exploration of the symptom,
Yeah.
will help you getting 50%
Yeah.
of
Yeah.
the
Yeah.
diagnosis from the history taking. All
That's
right.
true. Uh-huh. Uh-huh.
Okay, darling. So this is in terms of the data gathering. So you missed some questions in the exploration.
Yeah.
In the differentials, you asked me about fever,
Mm-hmm.
neck stiffness, as far as I remember.
Mm-hmm.
Let me share the picture with you, doctors, just to enhance the visual memory. Okay.
Yeah.
So the headache is acute 3 days ago. So you
Mm-hmm.
exclude meningitis and fever. You exclude facial weakness and arm weakness. And please,
Mm.
vision, doctor. Vision,
Yeah.
vision, vision.
Vision. Yeah.
You didn't ask about vision affection.
Mm-hmm.
Okay. And once I tell you I have headache in the front of my head and in my cheeks, always
Mm-hmm.
think about sinusitis. Ask
Yeah.
about discharge. Once I tell you I have discharge from my nose,
Mm-hmm.
ask me about any blood coming
Ah.
from the nose.
Okay.
If you didn't ask about the eye affection, please ask about the eye affection.
Okay.
Also, you can ask about eye pain to
Mm-hmm.
include infection in the periorbital area.
Right. Right.
Okay, these are your red flags once you suspect
Mm-hmm.
sinusitis.
So periorbital, we would say like around the eye.
You can ask about eye pain,
Okay. Right.
okay, and also swelling in the eye,
Mm-hmm.
redness in the eye. You can
Mm-hmm.
also ask about discharge from the nose. Is it bloody, to exclude cancer? All right.
Mm-hmm. Yeah, or
Okay,
polyp or
sinusitis can
anything.
be cancerous. Okay.
Yeah. Yeah.
So these are the things in your history taking
Yeah.
in this particular case.
Okay.
In the past history, you don't need to include family history.
Yeah.
You could ask about allergy. I'm okay with that.
Yeah.
Uh,
I.
yeah, you asked me about what do I do for my living,
Uh-huh.
ideas, concerns, and expectations, which was really good. In the examination, when you say your examination in the exam,
Mm-hmm.
please
Mm-hmm.
say it as a block. All right.
Right.
Avoid saying to the examiner or to the simulator, I would like to check your temperature. What is the temperature?
Oh, no. They give the investigations.
Yeah, they give a paper.
Mm-hmm.
Okay. The paper includes everything that you
Mm.
mentioned. So mention all of the things first. Okay.
Mm-hmm.
And then they will
Right.
give you the
Yeah. Yeah.
information. All right.
Mm-hmm. Mm-hmm.
Okay. This is in terms of your data gathering.
Right.
So you missed few things in the exploration.
Yeah.
You asked some irrelevant questions in the past history,
Yeah.
and the examination, please make it as a block. Okay.
Right. Right.
In the management skills,
Mm-hmm.
you got too much time, or you had to take too much time to explain sinusitis to me.
Yeah.
Okay. And to be honest, you were not very clear to me.
Right.
All right. So you can say to the patient, all right, what I'm suspecting, or from what you have told me, I'm thinking about something called sinusitis. Have you ever
Exactly.
heard about that before? No. Then
No.
explain to him what are sinuses first. Tell him,
Right.
all right, in our head, we have spaces. These
Mm-hmm.
spaces are air-filled spaces, like a cushion in our uh, head. Okay?
Right.
When these spaces got inflamed or
Right.
infected,
Mm-hmm.
you will have these symptoms, the symptoms that you have.
Oh, okay. All right.
Okay? Why you have inflammation or infection? I
Mm-hmm.
think because you have an infection before. This
Uh-huh.
infection is spread to the sinuses, and that's why you have these symptoms, the headache and discharge from your nose.
Right. Mm-hmm.
Okay, so take it or build the knowledge of the patient from the start. Explain to him what are the sinuses, what do you think, why, what happened to the sinuses, and link them to the symptoms that he has. All right.
Mm-hmm. Mm-hmm.
So my advice to you in your case is practicing on how to explain things in a better way. All
Right.
right, in a
Yeah.
simple way. Okay,
And sim-
Dr. Musarraf.
Yeah.
Also the time management.
Mm-hmm.
You
Yeah.
are starting, and I'm happy with what you have done, to be honest.
Right.
I know that you are starting, so I'm happy with what you have done. So just
Mm-hmm.
keep it up. When I told you the problems, I tell you the problems just to make an improvement on them.
Thank
Okay?
you.
It's
Thank
not
you.
a kind of criticizing you at all. All right? It's just
Okay. Thank
telling
you.
you what are the mistakes and how to improve them, and that's it.
Oh,
Okay?
no. Thank you,
But
doctor.
you're,
I'm happy with that. Yeah. So,
yeah,
doctor, just a question about this antibiotics. Like we do the other management because we give the steroid spray and we ask for the sinus rinse. So, apart from that, like the patient has got a greenish flame, are we going to give the antibiotic because it's now 4 days?
yes, you can consider giving antibiotic. It's not a
Right.
problem.
So, should we say about the amoxicillin, or should we not say the proper the specific antibiotic?
If you have the name of the medication in your mind, you can tell the patient, but
Okay.
you can tell him we can start you on antibiotic. And
Right.
once the patient asks you what antibiotic, doctor, then you can tell him.
All
Okay?
right. Okay.
It's not a
Okay.
problem at all, Dr. Musar.
That's that,
All right.
that's right. Thank you very much.
Okay. Let's talk about the marks for Dr. Musarrat. Okay. So in data gathering, I would give you 2, Dr. Musarrat.
All right.
Need some improvement in the management. You just managed to tell me the diagnosis, and it needs improvement. So 1 in the management. Okay.
Mhm.
Interpersonal skills, I would give you 2.
That's
Okay.
all right. Okay.
It's okay for a start.
No, that's fine.
Don't just feel down, please, at all.
Mhm.
Okay. As a start, it's a very good start. All
Okay,
right.
that's fine. Thank you very much.
Thanks, darling. So if I give you a tick management and type,
Mhm.
okay,
Right. Yeah.
and language.
You
Okay.
mean the explanation of the?
Explanations, yes.
Okay.
Yeah.
That's,
Okay.
okay. Thank you, doctor.
Thanks, darling. All right. What examination? We are going to check observations of the patient, examine the nerves, the vision, and the back of the eyes, and ENT examination. Okay, you will examine as any headache case, but you will add ENT because the patient has sinusitis and nasal discharge. Yes, you can add fundoscopy, doctor. The patient has headache. Okay, fundoscopic examination, and yes, you can add neurological if you don't need to include neurological examination in this case, in this particular case, no harm. Okay. All right, but fundoscopy is it's better to include in this case. Okay. All right. So we have talked about the data gathering. You have to explore the headache very, very well. You have to exclude the serious causes of acute headache, and we have talked about them from the image or the picture that I have shared. Okay, please include the red flags of sinusitis. What are the red flags? Greenish discharge to exclude infection, bloody discharge, please. And is it from both nostrils or one nostril? Eye affection, please. Please, eye affection in any headache, eye affection. And if you didn't ask about eye affection in the headache part, ask about it in the discharge part. All right, if you suspect sinusitis. Eye affection, eye pain, swelling in the eye, redness. Okay. What else? These are the red flags in any sinusitis. All right, or the important red flags. So you explore the headache, you exclude the emergency or the red flags of headache, and then you ask about discharge and the red flags of sinusitis. This is the proper exploration and the proper history taking in sinusitis case. All right. Psychosocial, you can include it. Ideas, concerns, and expectations. Examine the patient. Check the observations. Examine the head. You can include the nerves, vision, fundoscopy, and ENT, ear, nose, and throat, please. In terms of the diagnosis, I have explained the diagnosis. Okay, simply and easily. Yeah. Then you tell the management. What is the management in any sinusitis? We have allergic sinusitis and infective sinusitis. All right. In this case, is it infective or allergic sinusitis?
Infected.
Infected.
Is infected. Okay. So it could be viral, it could be bacterial, but because the greenish discharge, you think about bacterial infection. In any sinusitis, you can put a kind of cutoff of 10 days. Before 10 days, you can treat the sinusitis conservatively. 10 days and above, you can give antibiotic, okay? But in this case, the patient has greenish discharge, he has headache, it's affecting him, then you can consider antibiotic. So it's based on this, the context and the situation. Yes, the guidelines says 10 days, before 10 days, don't give antibiotic, after 10 days, give antibiotic, but you have to think about it logically, doctors, okay? You can tell the patient, all right, we can wait for more few days, and if the symptoms are getting worse, then we can start you on antibiotic. But consider them, consider, and mention that we are considering giving antibiotic in this particular case. All right. What is the advice? So this is the treatment, okay? From your side, as a doctor, you will consider giving antibiotic. From the patient side, have a rest, plenty of fluids, painkillers if paracetamol is helping, and I told Dr. Musarat paracetamol is helping, so continue taking paracetamol regularly, right? Nasal irrigation and safety net the patient. This is in this particular case. Let's do the next case.
Begin.
What?
Hello,
Hello?
I am Sitana, one of the junior doctor here in the GB clinic. Could you confirm your name and age, please?
Yes, doctor. I'm Michelle Armstrong and I'm 45 years old.
Is that okay if I call you Michelle during the conversation?
Yes, doctor.
Michelle, I can see that from my note, you have a headache, and now that I can feel that you are holding your head. Are you okay?
Yeah, I'm fine, doctor. I'm fine, but I have this headache for a long time and it's
I'm so
it's
sorry
getting
to hear
worse.
that.
Yeah.
You have this headache. I know it's not an easy issue, but I will do my best to help you today.
Okay.
So, could you tell me a little bit about this headache? You said that it's long time. Yeah, tell me a
Yeah.
little. Is that okay?
Yeah, it's for 1 month now, doctor.
Mhm. So you have been having this headache for 1 month. So in a score from 1 to 10, as 1 is the mild one and 10 is a severe one, how could you score the pain you have?
6, doctor.
All right. Is there anything makes it worse?
Nothing. But it's getting worse in the morning.
Mhm. All right. So is there anything makes it better?
No. Sometimes when I stand up.
Mhm. Do you have any do you try any medication?
I tried paracetamol, ibuprofen.
Mhm,
Sometimes it helps, sometimes no.
mhm. So, is there anything specific happen for you before 1 month before starting having this headache?
No, doctor.
Mhm. All right. So, do you have a fever?
No.
Okay. Uh, are are you so if you don't mind, do you have any idea about what's the cause of this headache?
No, doctor, I don't have any idea.
Mhm. All right, so I'm here and I will try to help you. So, this headache now for 4 weeks, does it affect your life?
It is affecting my life a lot, doctor. Yeah.
Mhm,
When I have this headache in the morning and
mhm,
it's severe in the morning, I
mhm,
just lie down on the couch without doing anything. I can't
mm,
help my family.
mm. So you said that you can't help your family. So, is there anyone take care of you and if you have a kids?
Yeah, I have my kids, 2 children. Yeah, my husband is helping me. He's very supportive.
Okay, all right. So, what are you doing for a living?
I'm a housewife.
All right. So, Michelle, if you don't mind, could you tell me a little bit about your period? Maybe it is sensitive questions.
Yeah, my period is regular. What do you
Uh,
want to know about?
Okay, just I would like to know if they are regulars
Yeah,
and
regular.
if you experience any pain or tenderness before starting periods.
No,
All right. Uh, okay, and you said that this headache is mainly during the morning and it's affecting your life. Uh, okay, so is there anything else apart from having this headache?
sometimes I do have vomiting in the morning.
All right. So it is. Could you tell me, is it unilateral or all over your head?
Yeah, all over my head, doctor.
All right. By any chance, do you have any stress in your life?
No, just the normal stress.
No, anything is stressing you.
No,
Okay. So this headache, do you feel like you have like a band around your head?
band? No,
All right. Okay. All right. So, what about your vision?
yeah, I do have blurry vision, doctor.
All right. Could you tell me a little bit about that, please?
It started with this headache, and
All
yes,
right.
I feel like I can't see properly.
And is your eye watery sometimes?
No,
All right. So apart from having this blurry vision, do you have any other symptoms I have to know about?
no,
Do you have any pain when you are chewing or combing your hair?
no.
All right. So, if you don't mind, may I, and what are you expecting from us today?
2 minutes remaining.
I just need to know what do I have.
All right. So, may I examine you? I would like to do for you vitals, and I would like to assess your blood pressure, and then I will assess your. I will do for you like a neurological examination, if that okay with you.
Yes,
Yeah, I will run some blood tests. Okay. All right. So I can see that from measurement of the good news, all the investigations are okay, apart from your body mass index. I mean, by body mass index, the weight, I measure your weight and I calculated your height. So this is what we call it, body mass index. It is above the normal limit. Um, and this put you at the risk of having a specific type of headache. The good news, it is not life-threatening condition. Are you
yeah,
following me?
yes, doctor. Yes, yes.
Yeah. But still, I need to involve my senior.
Okay.
Yeah. And we will provide you with a painkiller to ease this pain you have. And we will keep an eye on you. And the important thing to I think what I would like to say that if you work on your weight, I know it is not an easy issue, but this will help you very much to get rid of this headache. Does that
Okay.
make sense
Move
for
on
you?
to the next
Yes,
station.
doctor. Time is up.
Oh, oh my goodness.
Okay.
I forget, you know, completely to get the name of this condition. I feel I know, yeah, it is. Yeah, so when the lady have like high body mass index and the visual acuity are impaired, but I'm trying and I digging in my brain to get out, but fasting
It's
sometimes makes you.
it's fine, darling. It's fine. First of all, I want to, you know, um, uh, I want to say that you are brave enough, okay? Because this is the first time for you to do a station in front
Yeah,
of many people. I think you are starting your preparation, right? Because
yes,
your exam is in June,
yeah.
okay? This is a very big step. This is a very big step. So I
Thank
have
you
to
very much.
admit that, yeah, keep it
Thank
up.
you.
You have a
Thank
good,
you very much.
yeah, you have the confidence, all right? But you need just to add some a kind of some knowledge or
Mhm,
organization of your thoughts.
mhm.
Okay? All right.
Okay.
This is the first thing. The second thing, what do you feel about uh, your performance
Begin.
in general in terms of the data gathering?
Uh, I feel that like myself at the beginning, I was like little bit unorganized. I was jumping because when I
Okay,
found that
I
she's a
do agree
lady,
with this.
it
Yeah.
could be like BMS. So and then after that, I was, and I said for myself, this is 4 weeks, so this is not something acute. So I have to think about the chronic causes of headache.
Mhm.
So yeah, I started with you, and I want to just to grab anything to find my way. However,
Okay,
I feel myself like I was, because I forgot about this condition completely. To be
it's fine.
honest, now even I can't remember its name.
It's fine. It's fine. Increase intracranial pressure. But I'm happy that you have done the case, and I'm happy that you have done this mistake so we can all learn from your mistake. All right? We are going to talk about what is the mistake and how to deal with if you feel like you are unsure about what you can do in the data gathering or what are the
Mhm,
questions that you need to include, how to move things forward. All
mhm,
right? Okay. So I will tell you my comment about your performance so you can improve them in the practice. Okay.
okay.
First of all, did you watch the video of headache in the teaching gyms?
No, because just last night I joined your group, so yeah.
Okay, no worries. Okay, so all right, this is my question because if you watch the video,
Mhm,
you will be able to deal with the headache case. Okay, all right. So just watch the video,
okay.
and then you will find yourself that yes, I can explore any headache now, and I can reach the diagnosis in a right way. Okay, please watch the video, the teaching gym of headache. All right, this is the first thing. Secondly, if we talk about the data gathering, you started by a good rapport with the patient, okay? But in your data gathering, in taking the present history, okay, in data gathering, we have what? History, examination, and in
Provisional diagnosis,
no investigations. These are the data
investigation.
gathering,
Yeah.
okay? In the history taking, we have present history, past history, personal history, 4Ps, psychosocial, and ICE, ideas, concerns, and expectations. Okay? In the present history, you have to explore the headache very well. You didn't. Okay? When I tell you anything, you tell me more. Can you tell me more? Can you tell me more about this headache? Can you tell me more about this blurry vision? Can you tell me more about this vomiting? It doesn't work like this. Okay?
Mhm,
If you have one symptom, Once I give you the symptom, explore the main symptom, then ask about the other symptoms. When I tell you another symptom, tell me, okay, did it start with this headache or not? Ask me specific questions. Don't ask, tell me more, or don't say, tell me more for anything. Tell me more only
At the beginning.
at the beginning.
All right.
Don't waste your time. Don't
Okay.
waste your time. Okay?
All right. Thank
So
you.
explore the headache very, very well.
Mhm.
You didn't explore, then you moved on to the psychosocial. How have you been affected? It's for a long time. Can you tell me what is your job? All right. This is not the right way to go in the history taking.
Mhm.
Even if it's chronic problem,
Mhm.
you have to explore the condition first.
Okay.
Find out what's going on.
Mhm.
Then you ask about the past medical history. Then you can think about the psychosocial part.
Chronologically.
Even if it is a long-term history or a long-term problem. Okay?
Okay.
This is the logic way to explore, right?
Okay.
Or this is the logic way to deal with any case.
Okay.
Present history, then past history, then you think about the psychosocial part.
All right.
How have you been affected? What is your job? Do you drive? Can you tell me what about your concern? Any ideas and these things? All right? Well, explore first. Find out what's going on. Yeah? So in the data gathering, you were disorganized. Okay, you were going back and forth between the categories of the data gathering. So taking the consultation. Okay. In the diagnosis,
2 minutes
I
remaining.
will give you a tick in the diagnosis because you didn't tell me what do I have. In the examination, I think you mentioned the examination of head, nerves, and vision, right? You told me this. Okay. In the findings, I give you papilledema, the fundoscope. You didn't mention anything about it. Edema or swelling in the back of the eye, right? So you have missed many findings in the case, either in the history taking or in the management, all right? Taking the issue as well. Why? When you told me the explanation of the examination part, you told me everything is okay apart from body mass index. We have to work on the body mass index, and you missed the issue of the case, which is increased intracranial pressure.
Yeah, because I couldn't diagnose it from the beginning because I missed it completely.
Yeah, okay, so issues. All right. Taking the management and taking the time because you spent time on the irrelevant things. Okay. If we talk about the quantitative data gathering, sorry, but I have to be harsh. Just
Yeah,
Move on to the next
definitely.
station.
work on your
Thank you
performance.
very much.
One
Because
data gathering, one management,
I
and
want
two
just
interpersonal skills.
to break the ice, you know.
All right. Okay. So I'm happy. I'm happy that you have taken this opportunity. I'm happy that we have explained all of these, so you understand now what should you do in any case, and how to deal with any case properly. Okay, and how to improve your performance in the history taking. You have to be organized. Okay, present, past, then psychosocial. In the diagnosis, you have to give me the diagnosis first, explain the examination part first, and then tell me what are you thinking about. Then you tell me the management. When you have findings in the examination, you have to explain the findings. Don't ignore one of the findings because you ignored the fundoscopic
Yeah.
findings. You didn't mention it at all, right? Don't miss the issue, okay? The issue is chronic headache, so you have to exclude the differentials of chronic headache, like maybe carbon monoxide poisoning, maybe increased intracranial pressure,
Mhm.
right? Then you can ask about the psychosocial.
All right. Thank
Right.
you very much.
The management should be organized, and we are going to talk about the management. Time, you have to spend your time properly. Ask the relevant questions, and then manage the case, give me the diagnosis, and manage me based on your thinking about the diagnosis. All right?
All right.
Okay. Well done for a first case, for a
Thank
first
you very
time.
much.
And
appreciate
yeah,
that.
keep it up, darling. Keep it up.
Definitely, yeah.
Yeah.
Thank you. Thank
Thank
you.
you, darling.
Jazakallah khair. Thank you very much.
Bye bye.
Bye bye. Bye
Yeah.
bye. Thank
Okay.
you.
Yeah. Okay. So you can switch off your camera. Then we can talk about the case. Okay, doctors. This case is what? Raised intracranial pressure. Raised intracranial pressure. Okay. Can you remember the picture? This is a chronic headache. It's not acute headache. Chronic headache. When you ask about chronic headache, or when you think about chronic headache, please don't miss this blue big dot. Increased intracranial pressure. And please don't miss the nose of the patient. Carbon monoxide poisoning. Chronic persistent headache. Increased intracranial pressure. Space occupying lesion or idiopathic. Increased intracranial pressure and carbon monoxide poisoning. Okay? What are your questions? You ask the patient. The patient gave you the clue from the first. It's getting worse in the morning. So you ask, do you have also vomiting in the morning? Okay. And ask about neurological symptoms. Space occupying lesion, facial weakness or arm weakness. These are the symptoms of space occupying lesion or increasing intracranial pressure. Okay. Morning headache, morning vomiting, neurological symptoms, eye affection, vision, please. Vision. Okay. You can include if the patient didn't give you any clue or any positivity for these, then you can think about carbon monoxide poisoning by asking about others at home. And usually the patient will tell you the headache getting worse when I am in my home, and when I get out, the headache goes away. All right? So this is in any chronic persistent headache or continuous persistent headache. In acute headache, we have talked about trauma, meningitis, subarachnoid hemorrhage, eye affection. Okay? Chronic persistent headache, space occupying lesion, increased intracranial pressure, neurological symptoms, eye affection. Got it, doctors?
Yes, many thanks.
Yeah? These are the things that you have to include in your present history. Explore the headache first, and then you can ask any specific thing happened. Then you can ask the past medical history. Do you have any medical history of any chronic medical condition? You can include the personal history here because it's chronic. Do you think that you follow a healthy lifestyle? Don't ask about diet. Can you tell me more about diet, please? Can you tell me more about your exercise, please? No. This is in terms of the history or the personal history. Psychosocial, how have you been affected? What is your job? Do you drive? If it's a vision affection, all right? Then any ideas, concerns, and expectations. All right, what is your management? What is your diagnosis first? You tell the patient you have increased intracranial pressure. It could be related to a kind of growth in your brain. I didn't mention that you have this, but we have to exclude this cause. The other cause is something called idiopathic. Idiopathic means without any obvious cause. But we have to exclude the other causes first, and then we can confirm that you have idiopathic increase intracranial pressure. With the body weight that you have increased body mass index. Usually this happens with the idiopathic cause, but we have to be in the safe side. We have to do our investigations first to confirm what you have exactly. You want to know what is the next step? Yes, doctor. Referring you to the neurologist, to the eye specialist as well, because he has an eye infection. They will do further assessment, further investigations. They might need to do a CT scan on your head. And based on what you have, they will treat you. We can start you on steroids for now, and then another medication called acetazolamide to decrease the pressure in your brain until you be seen with the specialist. Okay. Referral to the hospital urgently. He needs to be seen by a specialist. Yes. Yes, refer to the hospital. This needs to be an urgent referral. Urgent or immediate, you can say. How can we ask about carbon monoxide poisoning? There is a mnemonic called coma. This is the mind map of the carbon monoxide poisoning. Okay, the patient should have the headache now, chronic persistent. You can ask the patient, tell me more, then you explore the headache, where, anywhere else, how, is it continuous, anything that makes it better, anything that makes it worse, any association of this headache, does that headache makes you dizzy, sweaty, did you take any medications for it, any specific thing happened, then anything else, and anything else, as any headache, you ask about vision problem, please. Chronic persistent headache. If we take it, the man, okay, the head, chronic persistent headache, we asked about what? Space occupying lesion, any morning headache or vomiting, any facial weakness or arm weakness, any vision affection. Okay, then you ask, how about others at home? You include coma. What is coma? Others at home, outside, maintenance at home. Can you tell me about your gas? Any problem in the boiler, the gas boiler? Okay, and the alarm, carbon monoxide alarm. Carbon monoxide alarm. Okay, and these are the symptoms of carbon monoxide poisoning. Do you feel confused at all? Any shortness of breath, any chest pain, any weakness? You should ask about weakness in the start when you explore the headache. Okay, confusion, loss of consciousness, shortness of breath, and chest pain. Okay. Then you move on to did that happen before? Any medical conditions, any medications? You can ask about smoking if you want or if you would like. And then the psychosocial. And then the patient usually will talk with you over the phone. So you will ask the patient to go to the hospital. Go to the hospital with others at home to be assessed, do some blood tests, and give you oxygen. Okay? After that, please take paracetamol regularly, ventilate the home before you leave, check the appliance, and don't use suspected devices. And if you have any problem in your devices at home, please call National Gas Helpline. All right, this is if you have time. This is if you have time. But the main issue of the treatment in this case is sending the patient to the hospital to be assessed with others at home, get tested, blood tests, and oxygen. All right? Okay, doctors. So I think we have done 4 cases today. Thank you, doctors. Thank you so much. See you.
See you. Take care. Thank you so much.
Thank you. Bye
Thank you.
bye. See you soon.
Thank you. Yeah. Bye.
Bye. Have a lovely day. Jazakallahu khair.
You too. Who is talking? Who is
Bye.
talking?
مع
He's on-
السلامة ستنا.
Bye.
Bye.